Good afternoon, everyone. It's been a while since we have analyzed the typical tests from the KROK-1 database. So today we will try to analyze in detail the test tasks about infectious diseases caused by Escherichia coli and Salmonella. Some of the test tasks in this part of microbiology have some nonsense in the destructors. So today we will talk about these aspects as well. Let's start. Test number 1. A 20-year-old boy has been hospitalized for suspected food poisoning. The fecal samples were inoculated on the endo-agar, which resulted in the growth of a large number of colorless colonies. What microorganism is most likely to be excluded from the list of possible causative agents of the disease? We know that most strains of Escherichia coli have lactase and actively ferment lactose. So in their endonutrient medium, unlike other species presented with the answer options, we will observe the growth of red colonies of Escherichia coli and even with a metallic sheen. All other pathogens grow well on endomedium, but the color of their colonies will be colorless. However, some of them can ferment lactose, but slowly, or have a weak ability to produce lactase. For example, Yersinia enterocolitica grows on endo as faintly pink colonies with a darker red center. You can see in this photo. Pseudomonas aeruginosa also typically gives rise to pink small colonies. Proteus vulgaris and Salmonella enteritidis grow as colorless colonies because they don't ferment lactose. Therefore, focus on the correct answer, Escherichia coli, only Escherichia coli. It almost always gives red colonies a metallic sheen. Remember also sanitary microbiology. The presence of lactose-positive Escherichia coli indicates fecal contamination of water. So these Escherichia coli are subject to mandatory monitoring both in aquatic ecosystems and in other habitats. Under their keywords foodborne toxicity, we can exclude Proteus vulgaris and Pseudomonas aeruginosa, as they aren't typical representatives of these infections. Therefore, the correct answer is A, Escherichia coli. Test number 2. Escherichia coli culture of O111 serotype was revealed in the excrements of a sick child who had been given artificial food, which diagnosis is correct. This test has a very pronounced keyword, the name of the Escherichia coli serogroup, or 111, which causes cholanteritis. Remember, this serogroup belongs to enteropathogenic Escherichia coli. Their pathogen is transmitted to humans by the fecal-oral mechanism, and children can mostly become infected through food or water, especially those who are artificially fed. Other diseases represented in the destructors are caused by either other pathogens or other Escherichia coli serogroups. Therefore, the correct answer is D, cholanteritis. Test number 3. A 7-year-old boy has been diagnosed a cholera-like disease, vomiting, profuse diarrhea. The feces of the patient were inoculated onto endomedium, and homotypic crimson colonies with metallic sheen have grown. Which microorganism is most likely to be the causative agent of the disease? We have just analyzed the growth of enterobacteria on endomedium. By the way, Shigella zonae grows in mucous pink colonies on this medium, and NAC vibrios aren't cultivated on endo, especially since they are lactose negative. The first key phrase that can be used to mark the correct answer is the color of the colonies, red with a metallic sheen, and the second is cholera-like disease. Looking at this table, it is infection with enterotoxigenic Escherichia coli that causes watery diarrhea resembling cholera. Therefore, the correct answer is C. The fourth test. In the clinic, got a child complaining of abdominal pain, liquid stool with blood. At cultivating excreta on endomedium, grew crimson red with metallic luster colonies. What features should be examined for evidence of enteropathogenic Escherichia coli? In this test, the keyword is the group of Escherichia coli, namely enteropathogenic. Of course, their groups and serogroup of a pew culture can only be determined in a slight agglutination test with polyvalent than monovalent sera. This serotyping reaction allows us to determine the type of OR and K antigens, that is, according to the criteria of antigenic properties, so the correct answer is A. By morphological features, we can determine only the shape and size of bacteria. By culture, to study the characteristics of their growth on certain nutrient media and isolate a pew culture. By biochemical features, for example, to determine what sugars a pew culture ferments. Phage is determined using specific bacteriophages, but antigenic properties just allow us to determine the serogroup of Escherichia coli. So the correct answer is A. Fifth test about E. coli. At bacteriological investigation of urine, Escherichia coli has been revealed. Its microbial amount was 10 to the 6th power colony-forming units per 1 milliliter. What does such amount of Escherichia coli testify to? It is known that one of the paraclinical criteria for pyelonephritis is the detection of more than 10 to the 5th power microbial cells of Escherichia coli per milliliter in the average portion of urine. Therefore, the correct answer is D. Destructor A is incorrect because glomerulonephritis affects the renal glomeruli, and this disease has an autoimmune component, and the urine will have an increased leukocyte and protein content, not Escherichia coli. Moreover, the main etiologic agent of glomerulonephritis is beta-hemolytic streptococci of group A. B is also a destructor. In the early stages of ascending urinary tract infection, the pathogen enters the urethra, where it moves up to the kidneys. But at this stage, the number of Escherichia coli will be much lower. In addition, Escherichia coli not part of the normal urethral flora. Answer C is incorrect because Escherichia coli is not found in the air microflora either. And final destructor is answer E. Septicemia is a form of sepsis accompanied by systemic inflammatory reactions without purulent metastasis in the tissues. This is a very severe form of infection when the pathogen enters the bloodstream and multiplies, producing toxins. Septicemia is accompanied by a serious condition of of a patient which can develop as a result of many infections, including urinary tract infections, when the pathogen enters the bloodstream from the urinary tract, but not vice versa, from the blood to the urine, as written in the destructor E. Of course, the pathogen can be detected in the urine as a result, but less than 10 to the 5th power microbial cells per milliliter. Therefore, the correct answer is D, ascending urinary tract infection. And now let's talk about Salmonella tests. Test number 1. In the infectious diseases hospital received a patient with a preliminary diagnosis of typhoid fever. He was ill 4 days ago. What material should be used in the first week of the disease to isolate the pathogen, the causative agent of typhoid fever? To mark the correct answer, you need to recall the pathogenesis of typhoid fever. In the first days of the disease, Salmonella enter the bloodstream as a result of primary bacteremia. Due to the death of some Salmonella, and the toxin is released under the influence of bactericidal substances in the blood, which causes fever and other non-specific clinical manifestations. Therefore, during this period, typhoid Salmonella can be isolated from blood. So the correct answer is C, blood. In the other materials listed in the destructors, Salmonella will be detected later, on the 2nd or 3rd week of the disease. The pathogen is not isolated from serum. The correct answer is C. Test number 2. To diagnose typhoid paratyphoid disease, a viral agglutination test was performed. It was positive with typhoid or antigen at a dilution of 1 to 1600 and with typhoid H antigen at a dilution of 1 to 200. What does this mean? The diagnostic titer in the viral test is 1 to 200. This titer indicates the disease. Or antibodies appear at the beginning of the disease and then disappear, and H antibodies appear in lower titers at the beginning of the disease, but then persist for a long time. In this test, we see a positive viral reaction with OR diagnosticum at a serum dilution of 1 to 1600, which means that the patient has typhoid fever. If the person didn't have typhoid paratyphoid disease, the viral test would be negative, and such a high titer of O antibodies wouldn't be detected. So answer B is incorrect. When bacterial carriers are detected, another reaction is performed called the indirect hemagglutination reaction. During the incubation period, there can be no diagnostic antibody titer based on the stages of pathogenesis, so answers C and D are incorrect. Destructor E cannot be correct easy because the anamnestic titer will only be H diagnostic after an illness or after vaccination, and in this test task a positive result is indicated with OR diagnostic. Therefore, the correct answer is A, typhoid fever. Unfortunately, there is a similar test in the database, but with an agglutination result with O antigen of 1 to 800. In this test, the correct answer is recorded convalescence. But in fact, this result also indicates typhoid fever. A positive vital test is considered to be a friable sediment in the form of whitish flakes with O agglutination. The sediment is fine-grained, and with H agglutination it is large flakes. By the way, bacterial carriers of typhoid fever have antibodies to V antigen. Do you remember? Salmonella typhi has V antigen. For these pupils, an indirect hemagglutination reaction is used, in which the diagnostic titer is 1 to 40 or higher. Test number 3. In the infectious disease clinic patients hospitalized with preliminary diagnosis of acute gastroenteritis, at cultivating of excreta on bismuth sulfite agar, colonies grew. The colonies have a black color with a metallic luster. Presumably, what are these microorganisms? The most common bacterial pathogens of acute gastroenteritis are Campylobacter or Salmonella, depending on the country. But the most important keyword in this test is the name of the nutrient medium, because bismuth sulfite agar is a differential diagnostic medium for Salmonella, only Salmonella. As a result of the reduction of bismuth, their gastroenteritis pathogen will grow in black colonies with a metallic sheen. Therefore, the correct answer is D. Test number 4. A factory producing typhoid fever vaccine cultivates bacteria of a virulent strain in optimal nutrient medium. Then the cells are separated from the culture fluid by means of centrifugation and processed formalin. What type of vaccine is it? Formalin inactivates or kills vaccine strains of bacteria, so answer B is incorrect. Autovaccine is a drug of bacterial origin made from pathogenic or opportunistic microorganisms isolated from the patient's body. This is not stated in the test, so answer E is incorrect. Chemical vaccines are developed using a different technology, so C is a destructor. The toxoid is obtained by neutralizing the toxin by keeping it in a warm 40 degrees Celsius formalin solution for a long time, but the bacteria cannot be kept there, so answer D is incorrect. Therefore, the correct answer is A, inactivated vaccine. But usually the following vaccines are available and widely used. The V vaccine, which is given as a single injection, and the 221A vaccine, 3 capsules. And last test. For treatment of the patient with enteric fever, doctor prescribed levomycetine. In the next day, the patient's health got worse with the increase in temperature to 39 degrees Celsius. Why did his condition get worse? Levomycetine is a bacteriostatic antibiotic that inhibits protein synthesis in bacterial cells. The administration of levomycetine can sometimes cause a deterioration in health. This is due to the death of bacteria and the release of pathogen endotoxins, so answer C is correct. This cannot be explained by an allergic reaction, since the patient's condition didn't worsen immediately, but the next day, in addition to a fever. Insensitivity of the pathogen to this antibiotic also cannot explain the deterioration of the patient's health and fever, nor can it explain the addition of a secondary infection, so answer A, B, and C are incorrect. Reinfection is is an infection with the same pathogen after recovery, and the test doesn't indicate that the patient has recovered, so E is a destructor.